go ahead and call the meeting to order. First item on the agenda is the public comments. This agenda item provides an opportunity for citizens to address the board of directors on any agenda item or other matters relating to the NTMC. Each speaker will be given a total of 3 minutes to address any item. Anyone wishing to speak shall be courteous and cordial. Any person who wishes to address the board of directors regarding any item may do so by either completing the request to speak card located on the DCTA administrative offices prior to the meeting, or if participating virtually by utilizing raise hand function, ensuring when called upon your camera is turned on and your name displayed. Citizens that are not able to connect to the Zoom meeting must email his or her public comment to sspell@ntmc.com no later than 12 p.m. on Tuesday, November 16, 2021 to ensure the comment will be read. Board of directors are not permitted to take action on any subject raised by a speaker during citizen comments. However, the board of directors may have the item placed on a future agenda for action, refer the item to the NTMC officers for further study or action, briefly state existing NTMC policy, or provide a brief statement of factual information in response to the inquiry. First item on the agenda, next item on the agenda is the consent. Excuse me, I'm sorry. Do we have any comments? Keisha, I'm sorry.
No, we did not have any emailed comments, and there is no one here in the audience that wishes to speak at this time. Thank you.
Thank you very much, Keisha. I apologize for skipping over that. Okay, next item is the consent agenda. Consent agenda is consider approval of minutes of the NTMC regular board meeting October 27th, 2021. Do we have any comments, additions, or deletions, or a motion?
Move approval.
Have a motion to approve.
Second.
And a second. All in favor, please say aye.
Aye.
Opposed, please say no. Motion passes. Thank you. Next item is the regular agenda. It's a discussion of NTMC operators and employees' health insurance benefits presented by Adam Kenyicki. I hope I didn't mess that up, of Holmes Murphy, and Julie Rickman of Holmes Murphy.
Yes, I'll take it from here. You did pronounce that correctly. My name is Adam Kenicki. I'm representing Holmes Murphy. I'm joined by my teammate, Julie. Julie, you can say hi to everybody as well.
Hi, everyone. Most of you, a lot of you know me already. I've been to several of your board meetings in the past. So again, Julie Rickman with Holmes Murphy. I've actually worked with NTMC for quite some time now. So Adam's a little bit newer to the team, but you're in great hands with him for this presentation today.
Excellent. I appreciate that. So I'm happy to be here this morning to go over the renewal numbers with all of your lines of coverage. And if you all have the agenda and presentation that we submitted in front of you.
I apologize for interrupting. Yes. Can you hear me okay? We can hear you in the boardroom, so just stand by just one moment, please.
Sure. Let me know when you need me to talk and we can get a volume check.
Ladies and gentlemen, thank you so much for your patience. One moment.
Can the other board members hear us? Okay. I just want to remind everybody while we have a pause, this is a short meeting. We have an hour because we have 2 board members that have to leave at 9 o'clock, I understand. So when you have comments, if we'll make them to the point but brief so that we can get this done in an hour. Otherwise, we lose our quorum.
Okay, go ahead. Adam, please.
Sure. Can you hear me now?
Yes.
Yes.
Perfect. Okay. Yeah, so I'm happy to go over the renewal of all of the items. I am not able to share my screen this morning, so I am allowing you all to refer to the presentation, the PowerPoint labeled NTMC Board Special Session that I sent in last week prior to this special session. So today we're going to be going over we're going to be reviewing medical and vision through UHC. We're then going to talk about the renewal through Dental Select for dental, and we're going to wrap up by covering renewals from Mutual of Omaha and WEX. So to start out with, I want to talk about the renewal that came in for medical and the conditions surrounding it. So overall, your plan on average ran at a loss ratio of 93.2 on average from May of 2020 to April of 2021. We call that period, so from May to April, we call that the experience period. That is what United Healthcare is looking at when they decide how to calculate your renewal. So to run at an average of 93.2 is pretty high, considering most carriers, to maintain profitability, are going to want that to be a little bit more in the range of 85, maybe a little bit less than 85. So already that is looking like something that was going to merit an increase. The highest months, it looks like, were November and February, which ran at 189.1%, meaning that for every dollar that NTMC was spending for medical, United Healthcare was having to pay an extra 89 cents on top of that dollar. If that kind of gives you a little bit of context for the numbers that we're looking at in this renewal. In addition to that, the market trend for this year was 9.5%. We think about, we've talked a lot in just the public discourse about inflation. You think about how things get more expensive. So saying that market trend increased 9.5% means that it is 9.5% more expensive for our medical and pharmacy provider, UHC, to maintain the current level of benefits that we have. On top of all of this, there was a claims increase over the period, which can be linked to people not only going to the doctor for COVID, but if you think about for the first few months of COVID, people were really staying indoors and maybe putting off other doctor visits that they may have had. A claims increase of 26.6% during that experience period wasn't unexpected. I will say a fortunate thing that staying with UHC and having the tenure with UHC has provided is that you all were at a pooling point of 100,000, meaning that any large claims that were over 100,000, that amount, any large claims that were over 100,000, only 38% of that was creditable towards NTMC's claims experience. So for any large claimants on the plan, any large claims, only 38% of the amount of those large claims are being thought of as attributing to this renewal. In any case, I know we are short on time, so I want to get straight to it. For those of you who have already reviewed this material, you know that United Healthcare had initially given us a 29% increase on all medical premiums. So that's the HSA plan as well as the EPO plan. We got this number and immediately knew that's not favorable numbers. We immediately set out to cut that in half. If you want to go to the next slide, I'll kind of go over our methodology for cutting that number in half and reaching the now 13% increase that we are going to propose a motion for today in this meeting. So something that we acknowledge is the way that NTMC is running acknowledges that the population uses the plan, which at the end of the day is a very good thing. The fact that people are able to use the benefits which they have through their employer means that the benefits are valuable in a way. What we needed to do to lower this then is to look at ways that UHC could find the plan to be not necessarily more credible, but we needed to find ways to show them that in the future, the plan is not going to run in the exact way it ran with the loss ratio average of 93%. So one thing that we asked for immediately was high cost claimant information from UHC. In order to have our NTMC team, we worked with Cameron closely to review each of those high cost claimants and let us know if they were still on the plan, maybe they were transitioning over to Medicare, or maybe they've left the organization. That kind of information, giving that back to underwriting, helps them know, yes, we had these high cost claims this year, but maybe in the coming years, we won't have as high of claims because kind of the people who are repeatedly high cost have left the plan. We also decided to review alternate plan design. That was going to be the biggest way that we got the renewal down. And we also negotiated with them using what we call a not to market strategy. This is basically us providing them in good faith an acknowledgement that we aren't going to ask competitors for their proposals in order to try to get UHC's rate because they're the only people negotiating with us. We're trying to get that to a reasonable level. We did this for several reasons. I mentioned credibility in the last slide. We talked about how NTMC's credibility right now is 38%. As somebody stays with a provider, year after year, that credibility goes up, meaning that more and more of those high cost claims are not considered part of the overall group's how they renew, how they, I guess, provide the renewal increase. Does anybody have questions on this so far? I know I'm talking at 100 miles an hour. I can probably slow down to 80, put it on cruise control, and we'll still be exactly fine for this presentation. Pausing for questions for just a moment. Okay, I'll continue on. If you want to go to that next slide, just looking at plan designs, we were able to find some changes that got the renewal down from 29 to 21%. We knew, though, that we were not finished. What we were able to do with the plan designs, though, I'll talk about now. The major change with these plan designs and what's going to get us to the final designs that we have is taking us from the existing networks, which is Navigate and Choice, taking both of those to UHC's charter network. That's going to narrow the current selection of providers. I will say that it is higher on average. NTMC had a higher amount than what is average for a transition over to a charter network. 40% of the existing top 50 NTMC providers are still going to be within that charter network, which, like I said, is higher than the average of, I think they said, around 33%. But you can check the appendix later to see exactly which of those top 50 would be or will be in the charter network. So just giving the math equation here, combining the not-to-market strategy we used with changing the plan designs, as well as coordinating closely with Cameron to find out which high-cost claimants on the list were maybe no longer a part of the organization or would not be part of the organization's medical plan in the coming years, we were able to negotiate down to a final rate of 13% increase for both plans. What that translates to is going to be an annual cost going from, let me see. These annual costs are going to be in the appendix, and we can answer questions after this, but I wanted to get to the comparison of the plans here. For the HSA plan, like I said, that first row, one of the main things that's changing is going to be going from the Navigate HMO network to the Charter HMO network. That will decrease the amount of providers that NTMC has access to currently, but that doesn't mean that it's impossible to find providers. You'll note that other than a few changes here or there, like an increase to deductible and out-of-pocket max by a few $100s there, the plan design has remained relatively the same. I will say for the HSA plan, the coinsurance rate has gone from 20% to 30%. For those of you who need context for that, what that means is on a plan like this, once the deductible is met, so let's say that I'm an individual on the plan and I meet that $3,000 deductible, then I'm responsible for any remaining bills. I'm responsible for 30% of the cost, and the plan is going to pay for the other 70% of the cost. Does that make enough sense to everybody? Yes.
Adam, this is Sarah. So let me ask a question. I know you said
Sure.
The increase at the beginning was 26.6, and you have a high number of claimants that have caused the overall plan to go up. My question is, when you look at the increase here, is that across the board, or is it only to the ones who are the ones experiencing the higher cost? And is there an HSA health check with all of these employees prior to the benefit? So for instance, they go through a health check, blood work, everything else. People who have passed the HSA, who have good health, or need to get on some kind of health plan, whether it's weight loss, smoking cessation. If they do not, then they go in and have to pay the higher cost. Do we have that?
So this is Julie. You want me to answer that, Adam?
Sure, Julie, go ahead.
Yeah, so those are great questions. So right now, your plan does not have any type of requirements for wellness when it comes to individuals on the plan. So that is something we can absolutely explore in the future to be able to ensure that people are going through, like to your point, annual physicals or having requirements regarding their own health status. I would say that there's a couple things with that. It's a little challenging being a fully insured group, meaning that there's only so much claims information that we can obtain as an employer, being fully insured. So there's some things that we're pretty limited to, but we can certainly work with Cameron and team to be able to come up with an idea for wellness in the future and requirements that folks will need in order to be able to be on the plan. As far as different tiering or plan designs, the way that your plan is, because of the number of employees that you have under the plan, it's aggregated as a whole. So these increases happen to everyone. It's not an individual, Julie Rickman has a condition, so therefore her insurance premiums are going up. This is as a group plan, group coverage, you have everybody goes into a pool where all of their claims go into that pool, and that pool offsets each other's claims. So I might have a bad year this year, next year Adam has a bad year, so my good year offsets his bad year, etc. Then because you're also fully insured, you will go into a large pool through United Healthcare, and that large pool helps offset for your group in general. So to Adam's point, when he was talking about those large claims over $100,000, NTMC doesn't realize all of those claims. Anything over $100,000 goes into a larger pool of other employers and helps offset for that. So we're not looking at individual coverages here. We're looking at group coverages and then a higher level of group when we talk about the pool as a whole through United Healthcare.
Okay, but NTMC pays 100% of all employees' healthcare?
There's NTMC has a portion that they pay. Then there's also dependent tiers where the dependents will pay portions of their coverage as well. I think we might have the rates as part of the backup to this in the appendix, and if not, we can get that to you relatively quickly.
But I guess what I'm saying is,
Yes.
if I'm an employee of NTMC, not my dependents, but just me, you pay for my health insurance and everything.
At the employee tier, all medical, dental, and vision is covered.
Okay, but dependents are the ones that are this really applies to.
Yeah, and it depends on how ultimately you end up as an organization offsetting the cost. So you might absorb more of the dependent funding if you wanted to or not. I mean, normally what ends up happening with these types of things is the increase goes and gets put back on the dependents, to your point.
Okay, thank you. I still think I just would say, any organization that's paying fully for just the employee, for two reasons. One is you as a company that is supposed to be helping NTMC or DCTA with their health plans. Honestly, y'all should be recommending that there's a health check, a well check for employees. We've caught some serious illnesses with our employees because we make them go through a health assessment. And it wasn't because we were trying to reduce our costs so much as it was to have our employees be healthy. But that goes back to what RJ was talking about with cost, and that is, would you rather have a workforce that's healthy and happy, or would you rather have a workforce that's having to go to the doctor and we have some high claimant and cost? I mean, I think to me the overall goal should be a healthy workforce, which will equal a happy workforce.
I absolutely agree with you. I think that there's a piece too to having a relationship with a primary care physician and ensure that people actually have a PCP in place. I think that's an important piece. There's a couple things that happened too with COVID. Most wellness programs kind of went to the wayside, and a big reason for that was just because there was no access to your PCPs for a chunk of time, and so a lot of employers dialed that back quite a bit for 2020 and didn't pick those things back up afterwards. But that's absolutely something we can explore and ensure that we get people to have their physician visits and figure out if there's some wellness components we can add to this plan going forward.
Okay, thank you very much.
You're welcome.
So I wanted to summarize this HSA plan summary so we can move to the EPO plan summary in just a second. The big changes here are changing from the Navigate network to the Charter network. The co-insurance going from employee covering 20% of the bill to covering 30% of the bill after they meet the deductible. And then there are some slight changes to deductible and co-insurance as well. Other than that, you can go ahead and switch over to the EPO plan. We're going to note the exact same change in network. So this is going to be from a Navigate network. I think I should say the choice network is what EPO had, over to the charter is the destination for that. You'll note that the deductible is a bit more of an increase than you saw in the HSA plan earlier. The HSA plan had an increase of $200, whereas the deductible for individuals on the EPO plan would be a $5,000 to $6,000, so a $1,000 increase for individuals. You'll note that the out-of-pocket max did not change by a lot. That's going to change by around $200 for the 7150 to 7350. You'll note that primary care and specialist copays did decrease overall. So primary care physician is going to cost you $5 less each visit, and specialist, rather than costing $100 or $50 if you go into the designated physician network, it's going to be a flat $60. So that can be a savings from the $100 or a $10 increase from the $50, depending on how you're looking at that. ER visit is going to increase by a $200 amount for the copay. That's going to go from a $300 plus deductible to a $500 plus deductible. One exciting thing to note about changing the EPO plan into this design is that coinsurance would go from the employee having to pay 20% of the bill once deductible is met to paying 0% of the bill once the deductible is met. So even though you're seeing that higher deductible, you're seeing that increase, you are seeing that after that deductible, the employee is responsible for much less. So you'll see that as, you know, them not having to pay any of the bill after they've met that amount.
And
The pharmacy amounts, sorry, did you have a question?
Yeah, no, this is Julie. And to a point to this, the majority of your employees are on this EPO plan. There's very few that are on that high deductible health plan. I think you have 5 or 6 on the high deductible health plan. The rest of them are on
it's
this
4.
EPO plan.
We can go ahead and go into the next slide unless people had questions about the specific design changes. I'll pause for just a few moments. Perfect. So moving forward on this, an increase was warranted for this year. That being said, 29% was a lot, and I'm happy we worked it down to 13%. I think that's much more reasonable considering everything that we found with high cost claimants and the differences in plan designs that we ended up finding. This is something that we may see in future years, though, based on, if you think back to the slide that I had before talking about the medical and pharmacy trend going 9.5% up, as costs continue to increase, we are not out of the clear, even with our change in design. So that is something to consider as we budget for future years. As we look into future years as well, you might think, well, maybe UHC is just, you know, screwing us over, for lack of a better term, and we should move to a different group. That's not necessarily the case. What I like to include here is that while that may provide a slight relief for maybe the year that you switch over to a competitor because they wanted to steal the business, they wanted to earn your business, that doesn't necessarily mean that your organization is becoming a higher credibility organization. You're taking more of the impact of those high cost claims if you're constantly moving to a brand new claim. I think I hear a ringtone. Just make sure that you are on mute unless you have a question. Other things that I have here, and thinking ahead to your question earlier, implementing wellness programs to help focus on mitigation and prevention of those high-cost claim chronic conditions, I think is something that we can look into, even as a fully insured organization. And because we don't have access to all of the reporting we need. In fact, we really only get information on high-cost claimants at a maximum of twice a year. I still think that we can implement programs if you all see certain chronic conditions as, you know, reoccurring patterns for just your demographic, maybe even our location in the world. And then I also think that focusing on clinical intervention is a big part of this as well. What that means, that's part of our mitigation strategy. If we have a high, I guess, proportion of employees who we find are diabetic or pre-diabetic, being able to help the pre-diabetic people not get into the point where they're needing regular insulin or needing dialysis in extreme cases, that can be something that saves the plan money, even though we had to spend money to get this program in place, this third-party vendor in place to look for these solutions. Julie, do you have anything to add before I go into the vision renewal?
No, and I think I think it was Ms. Hensley that was talking about the wellness piece, and that's obviously something that we want to be able to address as well. The other thing that I think I probably would point out is looking back to the claims history of this particular population, it is run very high in general, and that's partially due to utilization patterns in general, high cost claimants and things along those lines. So an increase like this, we can continue to try and suppress, more and more every year. But the reality is it's eventually going to catch up and kind of build up year over year. So hopefully by having an increase of this 13% and making the changes that are there, then having that focus on wellness in the upcoming year, we might be able to, realize a much better renewal for following years. But to Adam's point in general, your folks use the plan, which is good. That's a great retention and attraction tool for employees. So it's not a bad thing they're using it. It's just what can we do to make sure that it continues to be affordable and plans that are competitive with the marketplace and any competition that you might have with other employers.
I'm going to pause for just a moment for questions, and then we'll move right into to vision. Okay, we'll go ahead and go to the next slide, talking about our vision renewal. Bundling, I should say, vision with our medical from UHC did also help to decrease our overall renewal rate to that 13% that we landed on. And we're fortunate that UHC offered us a flat renewal, no increase there, and we're getting the same services that we've had in past years with the vision that they've provided. I will say that this is something that this is a contract that we had to extend prematurely prior to this special session, simply because the contract that was originally written for vision had a length of 34 months. That might have been due to just a plan year change. Normally, when you think about contract terms, you think, it might be in terms of like 12, 24, 36. For this one to be 34 months means that we had to renew it 2 months before we may have normally renewed it.
Yeah.
So we did go ahead just for continuation of service. We did renew that with them sorry, Julie, did I interrupt?
No, and that was because we changed the plan anniversary of the plan on this, and so that's the reason why that it's not quite the right lined up. But to Adam's point, yes, it had to be renewed early just because of it.
That being said, it was renewed with a length of 14 months, so we won't have this issue again. It'll renew on the same cycle as we're used to, effective 1/1 every year. Does anybody have questions on the overall vision renewal? This one should be a pretty quick topic, and we can move on to dental. Okay, so Dental Select, we don't have specific reporting on the exact loss ratio, but what we've been told directly by our Dental Select reps is that NTMC was running 40% over what their target loss ratio is. If we take that as maybe $1 versus $1.40, which is 40% more, if NTMC is spending $1 on care, Dental Select is having to spend $1.40 in order to make that care possible. So they were operating at a loss, which does warrant rate increases in a lot of cases. We went ahead, we asked UHC to provide us a dental quote to see if we could maybe avoid this renewal increase, but UHC was not able to offer a competitive plan proposal. They cut it short by saying that they wouldn't be able to offer the same benefits that you all currently have with Dental Select unless they raised your current premiums by about 40%. So that was not on the table for this year at all. In future years, we may see United Healthcare come back with more competitive proposals, but that was not the case this year. We have some plan option comparisons for you. The initial increase that Dental Select gave us for the exact same coverage would be a 19% increase. There are some options available to us to have that only be a 14% increase, which helps us as we try to stay under that collective bargaining agreement 15% threshold. If you want to switch to the next slide, I'll show you what the current rates look like. That orange column, that second column, is going to have that 19% renewal that they had initially quoted us. The plan that Holmes Murphy is recommending is going to be in yellow. That's the third column. This one takes us from a 19% increase in rates to a 14.4% increase in rates. And the only plan design change that happens is that the annual maximum amount, so the maximum that the plan is going to pay out for the plan year, is changing from $2,000 to $1,500. That's really all it's going to be. The network is going to be staying the same. All of the other things are staying the same as well. So you'll see for people who have higher cost claims for dental, that $1,500 annual maximum will affect them more, but it's not going to affect, I would call it your basic and mid-tier service that you would normally think of for dental visits. Before we move on to low plan, does anybody have anything to add to that? Any questions? Once again, Holmes Murphy is recommending we go with option 1 to remain as low of a rate as possible. Okay, if you can move over to the next slide. Low plan, we're going to be looking at the first 3 columns in a similar pattern. So the current rates that you all are paying is in that purple first column. What they proposed was that 19% increase in orange, and in yellow is what we're recommending. That's going to be option 1. And what that change entails, it's saying move endodontics and periodontics to the major tier. The way that a lot of medical services are covered, things are either in a preventative tier, a basic tier, and a major tier. And usually what that looks like is the employee pays 0% of the bill in preventative, the employee pays about 20% of the bill in basic, and they pay about 50% of the bill in major. So having endodontics and periodontics moved from basic to major is not unheard of. In fact, a lot of plans that I've seen in the past year have done the exact same thing. So that may have just been a change that brings us a little bit more with the current climate of dental provision. If nobody has questions, I'm going to move over to the recommendations slide, which is next. This summarizes that we are recommending that you go option 1 with both the high plan and the low plan, which would merit a 14.4% increase and a 12.3% increase respectively. I have a slide at the very end where we can motion to approve all of these things at once. I do want to move over to Mutual of Omaha to talk about life and disability as promptly as we can, just to keep in mind our 9 o'clock deadline. But does anybody have questions so far on medical, dental, and vision? And I apologize in advance to the person operating the slides. You were doing a wonderful job. Thank you. I'm sorry, I'm kind of causing you, I'm talking in a way where you're like, okay, you go to the next slide. In any case, you can go to the next slide. And we're talking a little bit about the renewal that we got with Mutual of Omaha now. What we're seeing is life is staying at the exact same rates. Disability is increasing. And the reason that we're seeing that increase is that we've seen a 26% drop in participation in just overall voluntary life, and in disability specifically, we're seeing a decrease in lives on the plan. We're seeing that in short-term disability as well. We're also seeing a higher average age, which for disability plans means that there are a lot more risks in place for the plan. So Mutual of Omaha having to pay more money per disability subscriber. So Mutual of Omaha, they gave us this number at the very bottom of that page. They said that they're currently operating at a total premium deficit of $24K per year. Once again, meaning that for everything that, or for all of the services that they're providing versus what you all are funding, they are losing $24K on this plan. And so if you go over to the negotiated rate slide, which is next, they have offered us a rate pass on all life insurance, but they are increasing the short-term and long-term disability premiums. So the short-term disability, the initial renewal that they'd given us had a 42% increase. We cut that down to 29% increase. And for long-term disability, that's going to be a 10%. I have on the very next slide what that's going to look like every month. And I'm happy to calculate that out per year if anyone needs that. If so, go ahead.
Yeah, and I do want to point out on this too, because the rate claims experience that you had, the market, we actually went out to find out if there was any market relief that we can get by going to another carrier. And the market was not responding to the RFP. And the reason why was because your experience was so poor that they couldn't be competitive with your current rates were. So that has a lot to do. Disability went up with COVID quite a bit. There was a lot of people that went out during the COVID time because of, obviously the pandemic did not help anything with the disability rates. So this isn't unusual for the market right now. And they're being very conservative when it comes to quoting just because they're not 100% sure if we're out of the woods yet.
That's a really good point. And at the end of the day, just like the point you made earlier, Julie, about this showing that your plans are utilized, these are relevant benefits to your employees. This is something that it's good that you're offering it, because overall we know that benefits are a major incentive for people seeking full-time employment. So the fact that these were used is a good thing overall. The increases were merited from what we can see, and we can cross the bridge of looking for alternatives as we get there. But that's what we're looking for right now with life and disability. Does anybody have questions on that? If not, our slide operator, we can move over to talk about WEX. Yes.
Yes. On this page, the current monthly, is that per employee or is that all the employees?
That's every employee. So that premium is what the, let me see. I believe that's the per employee per month cost.
So the premiums on here is just what NTMC is paying for all employees for these pieces. So the only thing with the exception to that would be the voluntary life and AD&D, and that's what your employees are paying. But everything else, the basic life and the disability plans, that's the monthly premium overall, all in for everybody that's covered under the plan. It's not individual premiums for individual people.
Thank you.
I have a question. Are only NTMC employees covered under this plan?
Yes. Often with disability, you'll only see employee tier covered. You're not going to see dependents.
Medical, dental, vision, all the plans are only W-2 NTMC employees included on this plan.
So yes, though for all the plan, I'm going to make sure that I clarify. Most of the plans, so the dental, the vision, the medical, you can also include your spouse and children on the plans if you'd like to cover them as well, but they have to be full-time employees of NTMC to qualify to be on these plans.
Okay, but there's no one else other than NTMC employees on this plan.
That is correct.
Okay, thank you.
Perfect. If there are no further questions, we will move on to talking about WEX. This is going to be a pretty uncomplicated one to cover. WEX provides your COBRA, FSA, and HSA. And if you want to switch over to the next slide, there are no expected changes this year. You all are currently under a administrative fee rate guarantee through the end of 2026 plan year. So no increases are warranted. What we will need to do as a next step is to update them with our new COBRA rates and plans, but that's not something that the board needs to approve. That's just something on the administrative side. So I digress. Does anybody have questions on what WEX provides us? If not, we can move into our consideration section, which is where I'll kind of head it back over to the board. I've got an agendized list of the changes that we're proposing and what you all can vote on, if you will.
Well, we've run way long. Are we still losing Raymond and Sarah at 9 o'clock?
Yes, I'll actually have to drop off a little earlier than that because I need to
We got to move on to the next item then.
Okay.
What is the employee survey results?
Okay. If you want to switch to the next slide, it's got a list of.
No, we're going to move to the employee.
Yeah, can you just go over the costs? Or yeah, okay.
Yeah, what's the overall impact to the budget for this plan design?
Okay, Chair.
That's a good question. Yeah.
Basically, the impact, if you look at page 9, the memo that I provided, kind of give you an overall. We went over the background as far as the increases in medical. The current budget for operators for medical, dental, vision benefit was set at 10% in the budget, and for non-operators, it was set at 15%. And dental and vision budget was 10% for non-operators.
But RJ, do you have like an overall sheet that shows here's what we were paying and here's what is now we're going to end up, if we approve these rates, this is what the cost is going to be, and here's the delta from a budgetary standpoint.
Correct.
And I think Cameron also has those numbers on the spreadsheet. But basically, under the budget, we're budgeting for 55 operators and staff. And overall, with the medical increases, the dental, vision, STD, LTD, the difference of that from the budget that we have in place, the difference is $14,256. So we can use the same budget that we have in place to cover those costs. So it's the only impact would be in the next month or so if DCTA was to consider keeping the same service levels that we currently have, and we need additional operators, then I provided a scenario if we were to have like 78 operators. Currently, we have 64. Okay. But if we were to go up to 78 operators and the staff, that particular item was not budgeted. So the impact there would be quite substantial. 395,000.5 is the estimate.
Okay, so does Cameron have a sheet that shows that's here's the cost that we're currently paying for health insurance. Here's all we look at, here's how much is allocated in the budget. With the new proposal, based on what was being proposed, here's the delta. Is that the 300,000?
So, Miss Hensley,
Oh, you call me Sarah.
I'm sorry, I'm just trying to be. So what we did was we took the employer portion and we increased that by the 10% or the 15% that we had budgeted either for operators or non-operators. And we took the difference of the 2022 rates and of the increase. And we got a total for operators, we got a total difference of, if we go with 78 or 78 operators, it's 41,695.15. With staff, we had saved an average of $7,713. So if we take that and we, depending on how service goes, it's going to financially impact us in between 11,000 to 300 and something, 365,000 or 67, depending on which service levels are provided.
But those costs will be budgeted as part of the discussion with
Right.
the DCTA board. So I don't think it helps shape the decision that we need to make to talk about what may or may not happen. I think we need to focus, my opinion is we should focus on, are the plans as stated fair and reasonable? It sounds like they are from Holmes Murphy. Do we have enough budget between salary and wages and benefits as currently budgeted and approved through the DCTA board to NTMC, which I believe we do have the funds available? Any decisions by the DCTA board, when the DCTA board asks the question, how much more is this going to cost, will include, it's my understanding that they've already calculated these increases in those assumptions. So if there's any changes that would continue service, that shouldn't impact our decision today. I think what we need to do is focus on moving NTMC forward, continuing to provide and sustain benefits to operators so we can continue to keep a stable workforce. And it sounds like you have enough money. Again, if there's a change in December, that'll come in as a December NTMC board decision on what we do with insurance. That's my opinion.
Yes, and we do, just to reiterate, we do have enough funds available to cover the current level of operators we have right now and the staff.
Yeah, I don't disagree with you, Rain. I guess my point is, it would be helpful to have some kind of a sheet that showed, here's the drivers we have now. If you're projecting out 78 drivers, what does that equate to? And will there be funding there? Obviously, you can come back for budget amendments, whatever the case may be. We don't really know about the future of certain routes, I guess, too. And so I agree that we need to figure out what's the best plan that gives the employees the best health insurance. To me, that's my more bigger concern is what's the best health insurance for these employees with the least amount of impact from a financial standpoint to them, if anything, but also we have to be cognizant of the funds for NTMC through DCTA.
I agree, Sarah. Thank you. And if there's a simple slide or table that you could share with the board so we can see that before a decision's made, that's great. I have about 5 minutes left and then I have to jump off. So if there's a board action, then I think we need to as quickly as we can and being respectful to everybody on the board. I think you have a quorum, so you can make the decision if you need to continue to deliberate. But I'd like to understand very clearly what it is that you're asking us to approve.
I think don't you have a slide that says here's the breakdown of what the approval would be?
Yes,
Okay.
it was the last slide in the package that indicates, and since we can't show you that slide right now, but it's basically approving the medical plan design changes with the sorry, it's going to screen. There you go. 13% increase with the minimum plan design changes, approving the 14-month contract for the vision with the rate pass, so no increase to that. Approve the dental plan changes. Again, the rate increases for that 14.4 and the 2.3, and then the rate increases for the short-term disability and long-term disability, and approval for the WEX for rate pass.
And is the medical plan 1 year or is it more than 1 year?
1 year. With fully insured, it's very difficult to get anything longer than 1 year.
That's what I thought. Yeah.
Yeah,
So
unfortunately.
that's not a bad thing, honestly.
Yeah, I mean, if you run better next year, which
Yeah.
hopefully you can, and hopefully this 13% normalizes you a little bit. Hopefully next year is better than this.
I'll move approval, but I would like to move approval with the fact that, and ask that the company look at wellness, a focus on wellness the next time they come back, because I think that will help with your pre-existing conditions and understanding of what needs to happen, so you have a better handle on what's going on with the employees, and then to encourage them to be healthier and look at wellness as a focus for these individuals, and then look at tiers from a wellness standpoint. We do this here in the city with 1,700 employees, and we did it through COVID, and it certainly doesn't make everyone have to pay the higher rate.
Joe, before we move into the voting, is this posted as an action item, or is it posted as a briefing item?
Actually, the way it is posted as a discussion item. However, it just says discussion of NTMC operators and employee health insurance benefits. If you look at RJ's memo, it talks about what the recommendation is, and I think that's really what he needs. So what I would suggest, since the board requires all contracts to be approved by the board, that you go ahead and at least we get a consensus to recommend the NTMC president to enter into contracts with United Healthcare, Medical Vision, Dental, Mutual Omaha's, and any necessary budget amendments to the NTMC budget to reflect such change. Budget changes would have to come back to you as an action item, and then we'll have to put these contracts just on the consent for ratification in December, but at least we can start moving forward with execution of the agreements. That's my recommendation. You need me to repeat that?
I support that. So I guess it would be more of if people support it. And not a
Agreed.
motion.
That in the form of motion.
I'll second.
We have a motion by Sarah, a second by Raymond. Any further discussion or questions? All in favor, say aye.
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 Opposed, say no. Motion carries.
Thank you very much, and we appreciate it. We can move forward with open enrollment for our employees, and thank you again.
Thank you for your
All
time.
right, thank you, everyone. I have to
Thanks,
leave
Frank.
now.
you for your
See
time.
ya.
Yeah.
Bye.
Are you staying on, Sarah, or?
I can stay on for about 5 or 10 more minutes.
Mr. Chairman, I've got about 5 more minutes also, then I gotta go to a meeting.
I guess we got 5 minutes to do the next item, which is
Okay,
discussion, consideration, retention, recognition, referral plan, recommendation.
Thank you.
RJ and Mr. Henderson.
thank you, Chair. We, as we discussed last month, we kind of went over the retention and recognition programs that we have in place, and some of the things that we'd like to improve on with the current monies that we have in place in the budget. It's kind of just like reshuffling and allocating a little bit more funds in certain areas, and then providing like a sign-on bonus and increasing the referral bonus. If you go to the slide, it shows the slide. Oh, it's in, okay. You don't have the actual presentation. Okay. But basically, we did a employee survey from the last time we discussed. And I just wanted to give you some highlights of that. You have that in your packet. From the time that we put this together for the packet, we had 32 collected surveys from employees. That's about a third. We currently have about 35 to 37 surveys collected at this time. But basically, of the ones surveyed, we had 15 operators, 2 administrative staff, 11 maintenance, 11 operational staff, and 4 maintenance staff. And, basically it's, one of the questions was, do you feel secure in your job? And it's just like a 50-50 split. Some of them do feel secure, some don't. You turn to the next page. Some of the operators or the staff, the ones surveyed, 77% feel safe performing their duties each day. 23% didn't. We also asked them about safety improvements, what they would like to see implemented. The number one item that they'd like to see implemented is a safety cameras or camera equipment on buses. They also stated as a suggestion box, but we do have suggestion boxes already. Okay, no, that's just a moment. Okay, that's fine. And so it's interesting that the employees, how they feel more safe with camera equipment and things like that. That's something that we've been talking about in the past. Some of the feedback also suggests that we need, as managers, as supervisors, we need to be more cognizant, listening to some of their concerns, listening to some of their suggestions, and giving feedback as we do implement those changes or we don't implement. So we're going to make those changes within our management team based on this survey, and provide more feedback to them, more communication. It's been difficult only because of the pandemic, but we've been having more safety meetings lately, and it's gone a lot better as far as providing feedback to the employees, where we're headed, what are some of the obstacles and things like that. But one of the main things that came out of this survey was that employees just don't feel secure. They don't feel secure, and they're not of the unknown that's going on. So that's probably one of the reasons that they mentioned that people are, let's say, leave or there's a high turnover is because security of the job. So, and we all recognize that. We do know that. Let's see. One of the second to the last questions on the surveys. Do you feel proud to tell people about your work organization? 32% said they strongly agree, and 13% said they agree, and 39% said they were neither agree or disagree. But for the most part, I think it shows that at least more than half of the workforce is proud of where they work. And on the other half, we still have room for improvement on how to engage those in making sure that they love their job and love where they work. We discussed last time, and it was mentioned about the sign-on payouts and sign-on bonus payouts and referral bonus payouts. And I included in the slide, you go to the memo. Previous. Yeah, previous. More, a couple of more. One more. One more. One more. No. It's actually on the memo. On page 50 of your packet, it shows the sign-on bonus payouts. Last year, we paid $2,502. In 2020, $11,250. In 2019, we paid out $18,100. That was, so it's been decreasing every year. Referral bonuses at the same. In 2019, it was $7,500. 2020, $3,250. And last year, we paid on referral bonuses $1,000. So we do have some short-term recommendations and long-term recommendations. One is enhancing the recognition program by increasing our budget, and we'll just be shuffling money. We're just going to be increasing the current budget of $392 up to $1,500 for recognition type programs that we could that'll help us to recognize and employees a little bit better and provide maybe like a gift item or two for them and things like that.
So RJ, let me make sure that I'm hearing this right, because this may make, you're saying there's really no difference in the amount of money. You're just moving the money around.
Moving money, yes, ma'am.
Okay,
That's
so
correct.
you're not asking for additional funding.
No.
You're just want to be as the general manager. And I believe you have that authority as the general manager. Within the budget, all you're doing is moving the money around. If that is the
Correct.
case, I move approval.
And I do have this discretion. I do appreciate that, and I do recognize that. But I wanted to share with you some of the things that we're going to be doing to try to help retaining employees and keeping them, and just some things that we're doing. And I feel like maybe the board may not know and understand everything that goes on behind the scenes.
No, I appreciate it,
But
We have a motion for approval. Counselor, my only question, we have a motion to approve this in a second. Counselor, I'll make sure, does the general manager have authority to move funds from one line item to another within the budget?
Yeah, he would just have to bring that budget back to just for an amendment. If you're moving, you've got the money there, but if you're moving them around on different lines, that would have to come back to you as a budget amendment.
Okay.
That's normally how you would handle that.
Right, that's what I thought. That's what I did. But
And that's normal. It can be after the fact.
Right.
That's fine.
Yeah.
Right, I just wanted that in the record, right? That's what I thought, so I just want to make sure. So we do have a motion by Sarah, I believe, for approval. Is that
Yes.
correct, Sarah?
Yes, that's correct.
We have a second by Mr. Hayes. Any further questions or comments or anything? Thank everyone. I appreciate it. All in favor, say aye.
Aye.
Thank you very much.
Opposed, please say no. Thank everyone very much for all your help and work on this. I know it's been a challenging time, but we greatly appreciate your efforts. I'm sorry, but I think we have 2 people leaving, so that means we lose our quorum. So at this time, I guess we will just have to wait later. Or can y'all stay on to schedule another meeting, or do you have time? Do you have to go?
I got about 5 minutes.
Okay. I thought we were over. Okay. Well, then we need to schedule another meeting, our next meeting. Do we want to have a meeting in December? What would we need to discuss in December?
We need to, this is Joe. I would recommend that we go ahead and schedule one just in case we need to put the ratification of any of the contracts or follow-up stuff as it relates to the health benefits on there. So we probably should have one as a placeholder.
Okay. Normally it's the 4th Thursday. Which 22nd. What everyone's plans are. 15th for everyone. It's basically a month from now.
Let's see.
The 16th. I could do 13th. 14th. I can't do the 16th. I cannot do the 16th.
Is it possible to meet earlier in the month? Because, you start getting into the 20th of December that, some of us will, I know I'll be out of the office. So, and with the vote that DCTA is taking on the 2nd of December, I would think it would be very important for us to meet, soon after that. I'm just saying this as if there is a reduction in force.
Right. That's why I was thinking 15th or 16th. You want to do it the week before that? Is that what you're suggesting?
I think we
Okay.
have on the books a 8 a.m. meeting on December the 8th.
Right.
I'm good with that.
Is everybody okay with that?
Yes.
Okay, so we'll go ahead and have our meeting scheduled for 8 a.m. on December the 8th. Is there any particular item that someone would like to have on the agenda?
I think a discussion and decisions regarding DCTA's, the DCTA board action on the December 2nd. We'll know more, and I think after that, but I do think that should be the key topic of conversation.
Anything else? Anything from you, sir? Just the ratification of the health insurance. Okay. Okay, Counselor, anything else on there? You know of?
That is it. I think we covered everything.
Okay.
And by the way, there is no executive session today.
No executive session. And I apologize, we did not get to the spotlight, and I apologize. That person will do that next month. Thank everyone for being here. Appreciate it.
Thanks, everybody.
Thank you. God bless.
Bye-bye.
Bye-bye. Happy Thanksgiving.
Happy Thanksgiving.
Yes, happy
Thank you.
Thanksgiving.
Happy Thanksgiving.
Happy Thanksgiving, yeah.
We are
Thank you to the
adjourned.
board.
The time is 9:08 a.m.